Afternoon, everyone. This is the continuation of language processing in the human brain presented by Group 2.
Good day, everyone. I am Arabella Dayawon, and I am here to report about the linguistic characterization of aphasic syndrome. First, what is aphasic syndrome? Aphasic is a language disorder that affects how you communicate. It's caused by damage in the area of the brain that controls language expression and comprehension. Aphasia leaves a person unable to communicate effectively with others. A person with aphasia may have trouble understanding, speaking, reading, or writing. One of the most notable of characteristic of Broca's aphasia is that the language produces agrammatic, meaning is a characteristic symptom often associated with Broca's aphasia. It's characterized by a significant impairment in the grammatical structure of speech. Individuals with agrammatism omit grammatical function words, articles, preposition, conjunction, auxiliary verbs, and struggle to use correct verb tenses and sentence structure. The example, instead of saying, the cat sat on the mat, a person with agrammatism might say, cat mat. So, they understand the meaning, but their ability to construct grammatically correct sentence is severely compromised. So, like Broca's aphasia, agrammatism is a symptom of neurological damage affecting grammatical processing. Proceed to Wernicke's aphasia. Wernicke's aphasia is a language disorder affecting comprehension. Individuals with Wernicke's aphasia can produce fluent speech, but their speech is often nonsensical, filled with paraphasias or word substitutions and neologisms or made-up words. So they often have difficulty understanding spoken or written language. The example, a person with Wernicke's aphasia might say, the flippity gibbet went to the store and bought a frobnitz. This sentence is grammatically correct but semantically meaningless. So they may also struggle to understand simple instruction or question. So Wernicke's aphasia is a result from damage to Wernicke's area in the brain, crucial for language comprehension. So, this is the lateral or external view of the left hemisphere of the human brain, showing the position of Broca's and Wernicke's area, the two key areas of the cortex related to language processing. So, in Broca's area, it is located in the frontal lobe, typically in the left hemisphere or in most right-handed individuals. The image shows its position in the inferior frontal. So primarily, it involves in the production of speech. It helps in this area, it helps in planning and coordinating the muscle movements necessary for articulate speech. Damage to Broca's area can lead to Broca's aphasia. And then, it is characterized by difficulty producing fluent speech, although comprehension may remain relatively intact. In Wernicke's area, it is situated in the temporal lobe, also typically in the left hemisphere. The image shows it near the junction of the temporal and parietal lobes in the superior temporal gyrus. So it is primarily involved in the comprehension of language. It helps also in understanding spoken and written words, assigning meaning to them, and processing grammatical structures. Damage to Wernicke's area can lead to Wernicke's aphasia, characterized by fluent but nonsensical speech and impaired comprehension. So, overall, Broca's and Wernicke's areas are two key regions in the brain, crucial for language processing. Broca's area handles the motor aspect of speech production, while Wernicke's area handles the cognitive aspect of the language comprehension. While often discussed separately, they work together in a complex network to facilitate our ability to communicate effectively. Damage to either area can result in specific language impairments, highlighting their specialized roles in this integrate cognitive function. The provided image clearly illustrates their relative location within the left hemisphere of the brain. And that's all. Thank you.
Damage to different part of the brain causes different language problem. Some problem affect how sentences are put together, while other affect the meaning of the word. For example, damage to Broca's area might make it hard to speak grammatically, while damage to Wernicke's area might it hard to understand the meaning of the word. The kind of word substitution that people with aphasia make tell us how words are organized in our brains. Example, if someone says Paul instead of tall, it might be because those words sound similar. The mistake people with aphasia make tell us words like saying Paul instead of tall tell us how words are stored in our brains. We store words based on how they sound and what they mean. So words that sound similar or have similar meaning are often confused. The fact that the people with aphasia often substitute words that sounds alike or have similar meaning shows that the brain connect words that are related. Our brain do not just store words as a simple as they are connected in network based on their sounds and meaning. People with anomia, a type of aphasia, have a lot of trouble finding the right word. They know what they want to say, but they cannot seem to pull the word out of their mind. Example of Alice from the Wonderland, who is trying to remember a word and can only recall that it starts with letter L. Deaf people who have damaged the left side of their brain have trouble signing, just like hearing people with the same damage have trouble speaking. This shows that the left side of the brain is important for language, no matter how you communicate. The right side of the brain is usually responsible for visual and spatial skills like understanding pictures and direction. It's a part of the brain that helps us see and understand things in space. Even though the deaf people do not hear sounds, the part of the brain that processes sounds, the auditory cortex, is active when they sign. This is surprising because we might think that area would not be used for the sign language. This shows that the left side of the brain is still involved in sign language, even though it's visual language. Deaf people with damage to Broca's area, a part of the brain important for grammar, have trouble signing fluently and correctly, just like hearing people with the same damage. They might struggling to put signs together in the right order or use the wrong sign. Deaf people with damage to Wernicke's area, a part of a brain important for understanding meaning, can sign fluently, but their signs do not make sense. They might use made-up signs. They might signs a lot, but what they saying doesn't make sense. It's like they using the wrong word or making up words. Deaf people with language problems can still understand visual things like directions or pictures. In hearing people with language problems can still understand sounds. Their language skills are affected, but their ability to see or hear things is still normal. People with aphasia language problem are not stupid or physically disabled. Their problem is especially with language. They can still think, move, and hear, but they cannot have trouble using language. The left side of the brain is where grammar is processed, whether your spoken language or sign language. It's the same part of the brain that helps you understand and use grammar no matter how you communicate. The left side of the brain is specialized for language, which is systems of symbols and rules, not just about hearing or speaking. Language is more than just making sounds or just your hand. It's about understanding a system of signs and rules. The specific language problem that people might aphasia have tell us a lot of how our brain are organized for language. By studying how language is affected by brain damage, we can learn how language works in the brain. Language is separate part of the brain, and different part of the brain control different aspect of language. Language is like a special module in the brain, and different parts of the modules are responsible for things like grammar, vocabulary, and understanding meaning.
Good day everyone, I'm the next reporter. And for today's video, I'm going to tackling about acquired dyslexia, also known as alexia, is a reading disorder that arises from brain damage, typically in the left hemisphere. This damage disrupts the brain's ability to process written language, leading to difficulties in reading. We have two types of acquired dyslexia: depth dyslexia and surface dyslexia. Deep dyslexia, this type is characterized by semantic errors where individuals substitute words with semantically related ones. For example, they may read act as play or heal as medicine. This suggests that individuals with deep dyslexia can access the correct lexical neighborhood, a group of words with similar meanings, but struggle to retrieve the specific target word. Surface dyslexia. Individuals with surface dyslexia rely heavily on sounding out words, making reading slow and laborious. They struggle to read words with irregular spelling as they cannot rely on their visual recognition of the word. This suggests that surface dyslexia affects the visual processing of words, the ability to access the lexicon directly. The study of acquired dyslexia provides valuable insight into the organization and functioning of the brain-language system. The different type of errors observed in acquired dyslexia suggest that language is not a monolithic system but rather a complex, modular network. Deep dyslexia highlights the distinction between processing content words, nouns, verbs, adjectives, and function words, preposition, conjunction, and auxiliaries, suggesting that these word classes are processed in distinct brain region. And lateralization of the lexicon. Acquired dyslexia confirmed the lateralization of the mental lexicon to the left hemisphere. Damage to the left hemisphere significantly affect reading ability, while damage to the right hemisphere primarily affect the processing of ideographic symbols like kanji and Japanese. So the contrast between deep and surface dyslexia reveals different access routes to the lexicon. Deep dyslexia suggests a semantic route where the meaning of the word is access, while surface dyslexia points toward a visual route where the word's visual form is recognized directly. Further evidence from Japanese reader. The Japanese language provides additional evidence for the hemispheric specialization of language processing. The two writing system, kana, phonetically based, and kanji, ideographic, are processed differently by the brain. Left hemisphere damage impairs kana reading, while right hemisphere impairs kanji reading. This further supports the idea that different brain regions are responsible for processing different aspects of language. Both figures are three-dimensional brain scans showing the effect of stroke-induced damage in patients with aphasia. The dark gray areas represent the lesion site. So, in figure 10.5, the scan depicts a patient with Broca's aphasia. The lesion is located in the left frontal lobe. Broca's aphasia is characterized by difficulty producing fluent speech, although comprehension is often relatively preserved. The frontal lobe location of the damage is consistent with this type of aphasia. And figure 10.6, the scans show a patient of Wernicke's aphasia. The lesion is in the left postural, temporal, and lower parietal lobe. Wernicke's aphasia is primarily characterized by impaired language comprehension, resulting in difficulty understanding spoken or written language, while speech production, though often fluent, may be nonsensical or irrelevant. The temporal and parietal lobe location of the damage is typical for this type of aphasia. So the figure illustrates the location of brain function and how damage in specific areas lead up to distinct types of aphasia.
Hello everyone, so we are here now in the next slide, and the topic is split brain or split brain surgery and hemisphere function. And before we go up, we have a cut here by Wegan 1844. And the cut is, it takes only one hemisphere to have a mind. So yeah, that's the cut by Wegan 1844. Okay. So, split brain procedure. Split brain procedure involves surgically severing the corpus callosum. Corpus callosum is the bundle of nerve fibers that connects the left and right hemispheres of the brain. Okay? The corpus callosum is located in the center between the two hemispheres. Okay? This procedure is mainly used to treat intractable epilepsy, especially when seizures affect both hemispheres and cannot be controlled with medication. And by cutting the corpus callosum, the goal is to prevent the spread of seizure activity between the two sides of the brain. Okay? Although the procedure can significantly reduce seizures, it also results in a fascinating change in brain function, as in the two hemispheres can no longer communicate directly, and it leading to unique behavioral effects. So yeah, hope you get it. So let's proceed to the next one, and the next one is the independent hemisphere. So after the split brain procedure, the two hemispheres of the brain function independently, leading to different responses based on which hemisphere receives the input. For example, if the ballpen is placed in the left hand here, which is processed by the right hemisphere. However, the person can use it but cannot name it. Why? Because our right hemisphere cannot communicate with the left hemisphere. And if the ballpen is placed in the right hand here, which was processed by the left hemisphere, and the person can both use and name the pencil because the left hemisphere controls language. Okay, so and note that the right hemisphere can be described as creative and the left hemisphere as logical. Okay, and the next one is visual field and hemisphere separation. So our brain is divided into two halves called hemispheres, right? The left hemisphere and the right hemisphere. Okay? However, each hemisphere processes information from the opposite side of the body and visual field. Okay? So, let's talk about the right visual field and the left visual field. So, right visual field, this refers to what you see on the right side of your gaze. Okay, the visual information from this area is processed by the left hemisphere of the brain. Okay, this hemisphere is responsible for tasks like language. So basically, it can easily name objects you see in the right visual field. Okay, so while in the left visual field, this is what you see on the left side of your gaze. In a simple word, the opposite of your right visual field. So in this case, the visual information from this area is processed by the right hemisphere of the brain. So however, the right hemisphere doesn't have the same language abilities as the left hemisphere, but it can understand the object. Okay, so additionally, it cannot name it because the areas of the brain that control speech in naming are in the left hemisphere. Okay, um, wait, allow me to give you an example. For example, in some cases, like when a person has had surgery that disconnects the two hemispheres, which is a procedure called a split brain operation. Basically, they may not be able to name objects in the left visual field, even though they can recognize them. Okay, hope you get it. So, and the other one is specialized hemispheric functions. Okay, so each hemisphere of the brain has special strengths that help with different tasks. Okay, so my bad if I didn't include their tasks, so my apologize. So in the right hemisphere, we have three tasks, which are the pattern matching, facial recognition, and spatial tasks. So in pattern matching, the right hemisphere is great at recognizing patterns, whether it's identifying a familiar face or detecting a sequence of shapes and colors. Okay, so while in facial recognition, it is the hemisphere responsible for recognizing faces and reading emotions from them. Okay, so whereas the special task, the right side helps you understand where things are in space, like how to navigate through a room or estimate distances between objects. Okay, so and now let's proceed to the left hemisphere. Okay, because we have a two, the right and the left hemisphere. So here we have four tasks, which are the language and arithmetic, perception, temporal order judgment, and lastly, the arithmetic. So the next part is neural evidence of grammatical phenomena. And as for this part, it also has a quote by Stuart Seaton. Yeah. So let us know. Here it is. The human brain is the most unusual instrument of elegant and yet unknown capacity. So yeah. So ERP, or the event-related potentials. ERP refers to brain activity that happens in response to specific events, like hearing a word or seeing something. And when the brain processes information, it creates tiny electrical signals. Scientists measure these signals using electrodes placed on the scalp. So, this helps them understand how the brain reacts to a different language or cognitive tasks like recognizing words or making decisions. For example, when you hear a familiar word, your brain generates an electrical signal that can be measured. Basically, the ERP shows how quickly and strongly the brain reacts to this stimulus. Okay? So the next one is MEG, or magnetoencephalography. So magnetoencephalography is another method to study brain activity, but it measures the magnetic fields produced by the brain's electrical activity. Okay, and it is a bit like ERP everyone, but uses a it uses a different tool. Okay, so however, MEG helps scientists understand the timing and location of brain activity when you are processing language or thinking. Okay, and as you can see here, we have two important concepts in how the brain handles the language task. Okay, so in language processing, MEG can identify which parts of the brain are active when we do things like listening to or speaking words. Okay, for example, um, it can show how we understand sounds, yeah, something like that, sounds, and recognize words or make judgments about grammar. Okay, so this helps researchers understand how the brain handles different language tasks. Okay, so hope you understand that. So the second one is hemisphere specialization. Okay, so the research using MEG shows the most language processing happens in the left side of the brain. Okay, and this is important because it supports the idea that certain areas of the brain are specialized for language tasks. For example, in many people, the left hemisphere is mainly responsible for understanding and producing language. Okay, so yeah, hope you get it. And additionally, both ERP and MEG are important. Okay, are important tools that help researchers study how the brain works. Yeah, how the brain works, especially in language and cognitive tasks, and also by recording brain activity in real time. So however, they give us a closer look at how the brain processes information like speech or thoughts.
Hello everyone, I am your next reporter. My name is AC Galman, and now we will talk about neurolinguistic studies of speech sounds and neurolinguistic studies of sentence and word structure. So let's start. So, brain responses to sounds. The human brain reacts differently to speech and non-speech sounds. Speech sounds activate the left hemisphere more. So what does this mean? This means that we learn how the human brain processes sounds. First, scientists found that the brain responds more strongly to speech than to non-speech sounds, especially on the left side of the brain. This also means that the speech has a special role in our brains. So number two, or next one, is evidence for linguistic categories. So brain shows categorical perception, different reaction to phonemic sounds like t versus k versus acoustically distinct but non-phonemic sounds like p versus So study shows that our brain can tell apart different types of sounds. So for example, it reacts differently to the phonemic sounds like t and k compared to the sound or that are just slightly different like p and f. For you not to be confused, p can sometimes change its sounds when it combined with the other letters. So for example, p and H together. Example when we say phone or phonics. In phone and phonics, P and H together is not pronounced as P, but it pronounced as F with the F sound. So this is called categorical perception. Lastly, language-specific responses. French and Japanese speakers react differently to the sound sequences based on their language rules or phonotactics. So lip signers also show specific brain responses to the sign language rules. This means that the brain response depends on the rule of language you speak. So for example, French and Japanese speakers react faster to the sound sequences that follow their language's rules. So even people who use sign language show similar brain responses when they sign match their language rules. Did you get it? So yeah, that's the meaning of neurolinguistic studies of speech sounds. So now, let's move to neurolinguistic studies of sentence and word structure. So number 1 is grammatical sentences versus meaning. The brain processes grammar even without meaning. Example, the man admired Don's headache of the landscape is meaningless but grammatically correct. So, this also shows that the brain reacts differently to meaningful sentences and meaningless ones. So, for example again, meaningless ones. The man admired Don's headache of the landscape. Okay? So, meaningful one is the man admired Don's sketch of the landscape. So see, they are different. So even nonsense sentences with grammar like Lewis Carroll's Twas per league and Slitty Toffs activate the brain's left side because they follow grammar rules. Okay? So number 2 is MMN or mismatch negativity. MMN is the brain's immediate response to grammatical error. So for example, a voice is running. Triggers MMN. Why? It is because the brain has a fast reaction to grammar's mistake called, as what I said earlier, mismatch negativity or MMN. So this happens in just 100 to 200 milliseconds. So for example, if you say a voice is running, MMN is triggered because the grammar is wrong. So let's move to number 3. Number 3 is sentence structure and movement. So it is how sentences with move objects are harder for the brain to process than move subjects. Why? So for example, which bagel did Seymour slice takes longer to process than who left the room. Okay? This is because the brain has to find the gap where the moved word came from. Okay? So number 4, the last number, is the importance of ERP tools. So ERP tools show how the brain separates syntax or the grammar and semantics meaning. Okay? And it processes grammar in milliseconds. So this also means that the scientists use tools like ERP to study how the brain handles syntax and meaning separately. No? So these tools shows that the brain can process grammar super fast even in a milliseconds. Okay? So I think that's all my part, and I hope you guys learned something. Thank you for listening, everyone.
Good day everyone, I am Hannah Maydi Baba and I'll be the reporter that will discuss about language and brain development. So, according to Lial Watson, if the brain were so simple, we could understand it. We could be so simple, we couldn't. So, it means that the brain is complex. If it were easy to understand, we wouldn't have the intelligence to do so. So, numerous neurolinguistic studies have found that the way the brain is organized for language and grammar in the adult is already reflected in the brains of newborns and young infants. In short, babies' brains are already wired for language and grammar even before they can talk. So, lateralization of language to the left hemisphere is a process that begins very early in life, even before language actively develops. So, it means that language is mostly processed in the brain's left side, and this starts developing very early, even before we can learn to speak. So, example, the Wernicke's area is visibly distinctive in the left hemisphere of the letus by the 26 gestational week. So it means that even before birth, a baby's brain shows signs of being wired for language. By the 26th week of pregnancy, the area of the brain responsible for understanding language, the Wernicke's area, is clearly developed in the left side of the brain. So babies also show early signs of having the brain structures needed for the complex rules of language that adults use. So as you can see, this comic strip illustrates the concept of left hemisphere lateralization for language in young children. So the panel 1, there's a child has reverted to baby talk, suggesting that language development isn't always linear. While the panel 2 it addresses the misconception that a child not speaking fluently is not developing language skills. So the third panel shows a child who is bilingual, highlighting the brain's capacity to handle multiple languages. And the fourth panel, a child is acting as an interpreter, demonstrating that even young children can understand and use language in complex ways. So the last panel, a child is curious about something who knows a lot. And the final panel emphasizes that the brain's capacity for language is similar across individuals. So in essence, the comic uses humor to illustrate that language acquisition is a complex process, but one that young children are remarkably capable of handling. So it shows how children can be bilingual, revert to earlier forms of speech, and even act as interpreters, all while demonstrating the underlying similarities in how brains process language. Between the ages of 5 to 12 months, the researchers videotaped smiling babies and babbling babies that producing syllabic sequences like mama or gugu. Controlled by right hemisphere. It occurs when the babies were smiling, their mouths were open wider on the left side. It means that babies' mouths open wider on the left side when they smile, showing the right side of the brain controls emotions, while the left hemisphere control. It occurs when they bubble the right side of their mouths. It means that the baby's mouths open wider on the right side when they bubble, showing that the left side of the brain handles language, and additionally opened wider, indicating greater left hemisphere involving for language even during the bubbling period. For example, infants as young as 1 week old show a greater electrical response in the left hemisphere to language and in the right hemisphere to music, similar to adults. ERP studies have found neurological correlates of categorical perception in infants just as for adults. It means that these studies show that the infant brain responds differently and with the same pattern and speed as found in adults to phonemic categories than to non-phonemic acoustic distinctions. So, this neural pattern occurs even in sleeping babies, showing that the response is automatic and does not require the attention of the infant. So, ang ginaano ni Derek kay the sleeping baby's brains automatically respond to language needing no attention. From birth, the left hemisphere of the brain distinguishes between non-linguistic sounds and sounds used in language. So from birth daw, the left brain tells apart language sounds from other sounds. So, the brain uses the same neural pathways for language processes from birth through adulthood. In short, the brain uses the same areas for language from birth to adulthood. The young children process sentence structure or syntax in the same brain area as adults, although slightly slower. Kids use the same brain area for grammar as adults but process slower. So in short, that the kids use the same brain area for grammar as adults but the process is slower. So the study used sentences with grammatically errors, nouns replacing verbs or vice versa, to test language processing in young children. So the study showed that the young children demonstrated increased activity in the left hemisphere of the brain in response to ungrammatically sentences. And 2 years old, it is the age of the children in the study on grammatically sentence processing. So the next topic is about brain plasticity. So it means that the brain's ability to adopt and recognize itself, especially during early development or after injury. It means that the brain can change and adapt, especially when we're young or after an injury. So there's two brain hemispheres, the left hemisphere and the right hemisphere. So ang left hemisphere means that it is specialized for language functions in most people, while the right hemisphere is supports early language development and can take over language functions if the left hemisphere is damaged early in life. Hemispherectomy, a surgical procedure where one hemisphere of the brain is removed, often done to treat severe epilepsy. In short, it is a surgery to remove one half of the brain, usually to stop a severe seizures. Aphasia, it is loss of language abilities, often temporary in children after a left hemispherectomy. It is temporary loss of language skills of a child. It is common in kids after their left hemisphere was removed. So, developmental patterns. It is a steps children follow in learning language. It means that it is if children lost the left hemisphere early, they can sometimes recover language skills using the right hemisphere. Adults, however, usually cannot recover language after losing the left hemisphere. So, the critical period, it is a time in early life when the brain is highly adaptable for functions like language. This latent linguistic ability, it is the hidden potential of the right hemisphere to manage language tasks. It means the brain's adaptability for language is greatest in early childhood and declines with age. So, these brain lesions, it means this is a damage to a specific area of the brain. There's two types, the left hemisphere lesion and the right hemisphere lesion. The left hemisphere lesion, it affects sentence and phrase formation, while the right hemisphere lesion, it delays the bubbling and vocabulary learning. So, the damage to the left or right hemisphere can lead to different types of language impairments depending on the brain's specializations. So, here's the general insights. The left hemisphere is mainly responsible for language, and the brain's ability to adapt and take over lost functions. So, the brain is naturally designed for language specialization in the left hemisphere but can adapt when damage occurs early in life.
On to our next topic, the critical period. A child is introduced to a language virtually at the moment of birth. From the moment a child is born, they begin to be exposed to language. This early exposure is crucial as it sets the foundation for language development. Now, if children do not receive enough linguistic input during their early formative years, they struggle to achieve native-like proficiency in grammar and language use. This period is vital for developing language skills. Behavioral tests and brain imaging studies shows that late exposure to language alters the fundamental organization of the brain for language. This means that studies involving behavioral tests and brain imaging reveal that if a person is exposed to language later in life, it can fundamentally change how their brain is organized for processing language. Early exposure is essential for typical brain development in relation to language. Now, critical age hypothesis asserts that language is biologically based and that the ability to learn a native language develops within a fixed periods, from birth to middle childhood. This hypothesis suggests that the ability to learn a native language is biologically determined and must occur within a specific time frame, typically from birth to middle childhood. After this period, achieving native-like proficiency becomes significantly more difficult. So, critical period, language acquisition proceeds easily, swiftly, and without external intervention. During the critical period, which spans from birth to early childhood, children learn languages easily and quickly. This process happens naturally and doesn't require much external intervention. The brain is highly receptive to linguistic input during this time. After this critical period, learning the grammar of a new language becomes much more difficult. Most people never fully master a new language's grammar if they start learning it after this period. So, children who do not receive adequate linguistic input during the critical period exhibit unusual patterns of brain lateralization. This means their brains do not develop the typical hemispheric specialization for language functions. Now, the wild or feral children who grew up in extreme social isolation serve as natural experiments for testing the critical age hypothesis. These children often lack exposure to language during the critical period, providing a unique insights into the effects of missing this crucial window. Now, no matter the reason for the isolation, whether it's due to being lost, abandoned, or raised in extreme neglect, it has a profound impact on a child's ability to learn language. So next is documented case of Jeannie. Jeannie was one of the feral children. Jeannie, despite her extreme social isolation, was able to learn a large vocabulary after being discovered. She learned words for colors, shapes, objects, natural categories, in both abstract and concrete terms. This shows that she had the capacity to learn and remember new words. So next is, however, despite her vocabulary growth, Jenny's grammatical skills never fully developed. Many of her sentences, even at the age of 15, resembled those of a 2-year-old child. This indicates severe limitations in her syntactic and morphological development. The structure of Ginny's sentences was similar to those produced by individuals with Broca's aphasia, a language disorder caused by brain damage affecting speech production, or those with specific language impairment or SLI. Her speech was fragmented and lacked complexity. Now, Ginny's speech lacked several critical grammatical elements, including articles, auxiliary verbs, the will or can, third person singular agreement marker, past tense marker, question words, who, what, where, etc., and pronouns he, she, they. So continue. Test of lateralization showed that Ginny's language was lateralized to the right hemisphere. This is atypical, as language is usually processed in the left hemisphere for most right-handed individuals. Her test performance was similar to patients who had undergone split brain surgery, severing the corpus callosum, or left hemispherectomy, removal of the left hemisphere. Despite these similarities, Ginny did not have any brain damage. Ginny's case demonstrates that language is not the same as communication because Ginny was a powerful nonverbal communicator despite her limited ability to acquire grammar. So Gina's case highlights the distinction between language and communication. Despite her limited ability to develop grammatical skills, Jenny was a strong nonverbal communicator. She used gestures, facial expressions, and other nonverbal cues effectively to convey her thoughts and needs. This demonstrates that while language or structured grammar and vocabulary is a key component of communication, it is not the only means of conveying information and interacting with others. So, despite significant limitations in grammar, underscores the multifaceted nature of human communication and the critical importance of early linguistic exposure. Moving on, Chelsea's case of linguistic isolation. Chelsea was born deaf, but instead of being correctly diagnosed, she was mistakenly identified as intellectually disabled. This incorrect diagnosis meant she did not receive the appropriate interventions for her condition. It wasn't until Chelsea was 31 years old that her deafness was accurately diagnosed. At this point, she was fitted with hearing aids to assess her hearing. Following her diagnosis, Chelsea received extensive language training and therapy. Through these efforts, she was able to acquire a large vocabulary, significantly improving her communication abilities. Chelsea has demonstrated the ability to invent new words when she doesn't have a term for something in her lexicon. This creativity shows her adaptive language skills, allowing her to express herself even when faced with gaps in her vocabulary. Next is Chelsea was able to learn new words readily, which shows her capability to expand her vocabulary. However, her ability to develop and use grammar was even more impaired than her vocabulary skills, highlighting a significant deficit in her linguistic capabilities. She developed no knowledge of grammar at all. Despite learning a large vocabulary, Chelsea did not develop any understanding or use of grammar. She could not form grammatically correct sentences, indicating a severe impairment in syntactic development. Now, brain studies show that Chelsea's response to language was equally distributed across both hemispheres of her brain. This is unusual because typically the left hemisphere is more specialized for language processing. Now, unlike typically developing individuals who show asymmetric brain organization for language, with dominance usually in the left hemisphere, Chelsea's brain did not exhibit this pattern. This atypical brain organization likely contributed to her difficulties in acquiring grammar. So her ability to learn vocabulary but not grammar, along with a typical brain lateralization for language, illustrates the profound impacts of linguistic isolation and the complexities of brain organization in language acquisition. More than 90% of children who are born deaf or become deaf before they have acquired language are born to hearing parents. So over 90% of children who are born deaf or become deaf before acquiring language have hearing parents. This high percentage highlights the challenge these families face in providing early linguistic input suitable for a deaf child. Most parents of deaf children do not know sign language when their children are born. As a result, these deaf children often experience delayed exposure to language, which can impact their linguistic development significantly. Now, research shows that deaf children who are exposed to American Sign Language or ASL from birth to age 6 perform much better in understanding and producing complex signs and sign sentences compared to those who begin learning ASL after the age of 12. This early exposure is crucial for their linguistic competence. So early exposure, especially from birth to 6 years old, leads to significantly better outcomes in language comprehension and production compared to delayed exposure. This emphasizes the importance of early and appropriate linguistic intervention for deaf children. When comparing the brain lateralization patterns, how language functions are distributed across the brain hemispheres of different groups: adult native speakers of English, adult native signers, deaf individuals fluent in sign language, and deaf adults who had not been exposed to sign language, research found that the non-signing deaf adults did not display the same cerebral asymmetries. Typically, language processing is more dominant in the left hemisphere. However, non-signing deaf adults lacked this pattern, unlike their hearing counterparts and deaf signers who showed more typical lateralization. Now, the study found that only deaf children who had their hearing loss successfully addressed with cochlear implants or hearing aids by the age of 8 months developed rich grammatical skills. This indicates that early intervention is critical for the development of complex grammatical structures and language. This finding supports the idea of a critical developmental window for acquiring complex syntax. The term window of opportunity refers to a specific period in early childhood when the brain is particularly receptive to language input, making it easier to learn and develop complex grammatical structures. Missing this window can significantly impact language acquisition. Now, the critical period for language acquisition is closely linked to brain lateralization, which is the process by which certain cognitive functions become localized primarily in one hemisphere of the brain. This period is crucial for the development of language-related areas in the brain. The human brain is naturally inclined to develop language abilities in specific areas of the left hemisphere. However, the normal specialization of these brain areas relies on early and consistent exposure to language. Without this early linguistic input, the brain's development in these regions may be compromised. Now, acquiring language plays a crucial role in and might even trigger the proper lateralization of the brain for higher cognitive functions. This means that the process of learning language can influence how other cognitive functions are organized in the brain. The human brain shows a significant impairment in acquiring the grammatical aspects of language if language learning does not occur within the critical period. This results in a persistent difficulty in mastering grammar, even if vocabulary acquisition is achieved. Now, the critical period specifically applies to the acquisition of grammatical skills in the first language. However, it does not necessarily apply to all aspects of language, such as vocabulary, which can be learned later with varying degrees of success. Now, language is distinct from other cognitive systems and is a complex system composed of various components, including phonology or sound systems, syntax, sentence structure, semantics, meaning, and pragmatics, language used in context. Now, this period is linked to brain lateralization and the development of specialized language areas in the left hemisphere. Missing this critical period can lead to significant challenges in acquiring grammatical skills, even though other aspects of language may still be learned to some extent. Language itself is a complex, distinct cognitive system.
Hello everyone, I'll be discussing about the modular mind, the dissociations of language and cognition. So let's start with the idea of the modular mind, which comes from the field of cognitive science. The basic idea is that our mind isn't one big, uniform system. Instead, it has specialized modules, like tools in a toolbox, where each one is designed to handle a specific task. For example, some parts of the mind handle language, some focus on problem solving, and others deal with emotions and movement. These modules work together, but each has its own strengths and weaknesses. From Neil Smith and Ian T. Maria Simple's quote, they highlight that the human mind has structure. It's not a jumble mess, but a system of components with specific purposes. A module for language might be extremely powerful, while a module for something like math or self-care might not function as well. This idea helps explains how some people can be extraordinary skilled in one area, like language. Even if they struggled in other areas, it's like having a powerful engine in one part of a machine while another part is underdeveloped or broken. Now, let's move on to linguistic savants. These are individuals who have significant intellectual or cognitive disabilities but show extraordinary abilities in language. Think of it as having a superpower in one specific area while struggling with everyday tasks. So, linguistic savants are living examples of the modular nature of the brain. They show that even when certain parts of the brain are impaired, other modules like the one for language can work exceptionally well. To understand this better, let's look at the two real-life examples of linguistic savants, Laura and Christopher. Their cases are fascinating because they illustrate how the mind's module can function independently of each other. In Laura's case, she had an IQ of only 41 to 44, which is considered very low. She had severe difficulties with tasks that most people take for granted. For instance, she couldn't solve basic math problems like 2 plus 2 or even figure out her own age. These are examples of non-verbal impairments where the brain's problem-solving or reasoning modules don't work well. Despite these challenges, Laura had an exceptional gift for language. She could create complex, grammatically correct sentences. For example, she would use proper verb tenses and even correct other people's grammatical errors. In Laura's case, it shows how the language module in her brain was highly developed, even though other areas were not. It's as if her brain had a specific strength in language while other cognitive abilities were underdeveloped.
Moving on, we have the specific language impairment. By definition, this means that it is a language disorder that affects a child's ability to learn language despite normal intelligence and no obvious sensory impairments. So, children with this condition, no, they have a specific language impairment, meaning that their language development is significantly delayed or impaired, even though their overall intelligence or their other cognitive abilities are normal. This type of condition is very distinct, or it's very different or unusual from other kinds of language disorder like autism or intellectual disability, where other cognitive functions are also affected. But in the case of SLI, here only one aspect of a person's cognitive abilities may be affected, and other parts may be normal. No, it means that there is only a specific part where there is a language impairment. So to identify if a person has specific language impairment, here are its signs. A person may have difficulty acquiring language or slower than average language development. So a person who has SLI mainly has a hard time acquiring language, but still has normal intelligence and cognitive abilities, meaning that its other cognitive abilities may function rightly, but its acquisition to language may have difficulties or may tend to be slower than average language development. Also, people with SLI has no sensory impairments, meaning that their hearing, that their vision is totally okay, it's totally fine. And one thing to note also is that um, the core difficulty of a person or a children with SLI often lies in grammar. They have specific grammatical difficulties. Particularly, we have function words, inflectional morphemes, and complex sentence structures. When we say function words, this means that they struggle to the use of small words like the, of, and is. And they also struggle with inflectional morphemes. These are suffixes used at the end of a word, like adding endings to indicate a tense. For an instance, when we add s at the end of a word to make it plural, or ed to make the word past tense. So they have a difficult time recognizing inflectional morphemes. And also, they have complex sentence structure. So this leads them to a challenging in comprehending instructions. It will be difficult for them to follow instructions because they cannot comprehend, and it's hard for them to also engage in conversations because their language is different. And children with SLI, no, let's for an instance, for example, they might say I go store. Though the statement is understandable, but it is grammatically incorrect. So children with SLI, they can still acquire language, but it has impairment or it is delayed. Lastly, we have the genetic basis of language. This means that genetic holds a vital role or a specific factor underlying language abilities and disorders. Meaning, genetic is a key indicator to know language abilities and disorders. Also, language can develop normally even when other cognitive domains are impaired. Just like earlier about the SLI or specific language impairment, a language still developed even though a part of the cognitive domain was impaired. And there are many different syndromes and anomalies demonstrate how language development interacts with other cognitive skills. So here we have 3 chromosomal anomalies and language profiles. First is the Turner syndrome. This means that a chromosome from a female have a single X chromosome instead of 2. Now, what does this mean to language development? Here, its strength is that it has a person can have normal language abilities and advanced reading skills, but its deficits is that it has severe non-linguistic cognitive impairments like visual and spatial. The significance of this is that it shows that language can still thrive despite deficits in other domains. The second one is the Williams syndrome. This means a genetic disorder caused by the deletion of genetic material in chromosome 7. So what does this has to do with language development? When a person has this genetic disorder, they have this unique behavioral profile with relatively strong language abilities, meaning that they are rich with vocabulary, they are good at storytelling, but their visual and spatial cognitive has impairments and has moderate intellectual disabilities. So, the significance of this type of disorder is that it illustrates a stark dissociation between linguistic and non-linguistic cognitive abilities. And lastly, we have the Klinefelter syndrome. By definition, it is a chromosomal disorder in males with an extra X chromosome. So the Klinefelter syndrome is an extra X chromosome in males, while the Turner syndrome is a lack of X chromosome in females. Now, what is the language development in the Klinefelter syndrome? Here, a person may have selective syntactic and semantic challenges. For like example, in sentence structure and meaning, they may have a hard time creating sentences and understanding meaning. But one of its strengths is that there is an overall intelligence that is remained intact. And so, its significance is that it highlights selective language impairments despite preserved general cognitive ability. So, what is the implication of this? All these studies, all these conditions, they underscore a complex interplay of genetics and cognitive development. All these disorders has a vital role as it provides researches and new studies about how genetics and biology can have a great impact in our language acquisition. Language can develop independently of other cognitive functions. Just what is shown by conditions like Turner and Williams syndrome, and also even the disorder like the SLI. It provides insight into the specific genetic underpinnings of language processing, particularly the importance of grammar and syntax.